Okay, ladies and gentlemen, we're going to wait a couple more minutes for a few more people to join in, and then we will begin. Okay, well, it's great to see everyone here. Happy, wonderful Thursday afternoon. Here where I am at, it is very sunny. I'm not sure other parts of the country what the weather is looking like. Hopefully it is sunny like I am experiencing. But Northeast is a little bit cold. I think it's about 34 degrees right now, but that's all right. We got the cold weather plus the sunshine. We're feeling good. Okay, so let me go ahead and explain what this first Thursday is going to look like. Let's turn on the captions, make sure those are enabled. There we go. All right, thank you for that reminder. So every month for the rest of this school year until our conference in April, the first Thursdays will be focused on potential CEASD's group strategic planning. So all of our initiatives will be discussed during this first Thursday. Last year, we had 5 initiatives and we almost completed them all and we just tweaked them a little bit. We will discuss more at conference, so I don't want to belabor that right now. Based on the surveys that we disseminated to all of our member schools, plus through board discussion and our work through CEASD over the years, we have identified 6 initiatives at this time. Keeping in mind that we will not be stuck with these 6 initiatives the full time. Oh, one moment, let me fix something real quick.
Just going to spotlight view.
All right, make sure everything is accessible. There we go. Perfect. Okay, accessibility, that's important. Thank you for sending me all of these feedback. I really appreciate that. So again, we've narrowed down to 6 specific topics. They are not written in stone. Let me go ahead and tell you what those 6 are. We have outreach, early intervention, diversity, language deprivation, least restrictive environment, or LRE, otherwise known as language rich environment, but we'll keep it with least restrictive environment, LRE, and hopefully that will become language rich environment. And then our 6th topic is data. Now, I want you all to remember that data has already established a work group that has been in progress for a while. So that's separate from today's discussion. Today, we will talk about the first 5. Again, these are not written in stone. We are not locked into these. If there is anything else that you feel CEASD should devote attention to, then please feel free to let us know. During today's discussion, we will have breakout groups for each individual initiative. You can join any of these. If you think of another topic during the breakout group, mention it, and the facilitators for each group will be documenting that topic, putting it to the side so that we can then review and further discuss how to address it. It may become another strand for our strategic planning. That is a possibility. As of right now, we do feel that these 5 topics are really strong discussion points that we want to move on. Now, The board will split up into 2 facilitators for each group. Some may have 3 facilitators, but for the most part, 2 to 3. We have established the breakout rooms already into those 5 different topics: outreach, early intervention, language deprivation, diversity, and
Ellery.
there we go. Now, you can go into any breakout group that you want to. Pick a topic for today to jump into. If some people decide that they really want to stay and hone in on that topic and delve into that discussion, then please do so. If you feel like you want to bounce around to see what the discussion looks like, then that is completely up to you. This is not just for superintendents. This is for any school administrator. So if you feel like you want participants in multiple groups, then please feel free to bring in your other administrators that may have expertise in a certain field. Maybe someone that is knowledgeable about LREs. So we want to make sure that CEASD is going towards a place where we can continually support the schools and not just thinking of the small picture, but making sure that we are looking holistically at the big picture. So again, every month, discussions will happen. Now, each discussion may be different. Today, we're calling it just sort of a first opening session, just to get an understanding of what we're focusing on, brainstorm what works, what we want to see CEASD do in the future. So today is just open discussion. Bringing in your thoughts, your opinions. What are some of the problems in the field that you have noticed? Further along, we will start to develop what next steps look like. So for example, today is brainstorming. Our next discussion group may be trying to establish clearly outlined goals. Further along, we will maybe establish some objectives under those goals and then set up action plans in order to accomplish them. So all of this will tie into each other so that at our conference in April, the board will be able to bring all of the discussion points, all of the goals and objectives and action plans from your discussions and present them to the general membership, making sure that that is approved, and then it will become CEASD's work within the next 5 years, depending on the outcome of that. So that is our frame of work for today. And that is what the first Thursdays of every month moving forward should look like. Hopefully we will all have fun. And I want our members to really get involved. I want you to feel like CEASD is here to support you because that is our ultimate goal. All right. So there are a few questions that are being sent to me in terms of when was that survey disseminated? I believe it was back in July, maybe August, and it was open through the Clear On group, and that's where we sent it out from. And so if you do have another topic or maybe something that you feel is a more serious need for attention, please let us know. We may go to 6 or 7 initiatives. We may decide that one has priority over another and stay at 5. So all of this could change. Like I said, it's not locked in and we are not stuck with these 5 at this time. Now, I know many of you have gotten to me about what are those problems that are occurring right now. And right now, the main one is shortage of staff. That seems to be a very severe long-term issue. And I get that. We get it. But hopefully you all can help us figure out what CEASD can do to support you in that arena. So today, that's how we're going to frame it. We're going to focus on the 5 that I mentioned earlier. If you have other thoughts, share them, and our facilitators will document them and get together after the discussion today to see what the priorities are, what it is an important topic that we need to focus on. The first Thursday in December, we may inform you of some tweaks that have been made each and every time. And then in April, hopefully we will be ready to present it to our general membership. Hopefully everything is clear cut for everyone and we are ready to begin the discussion. If If you have a comment or question, feel free to use our chat feature or open up your video and bring it on. Okay, well, it seems everyone has a good, clear understanding of what the process will be today. Now, let me clarify, the outreach facilitators will be Luann Barron and Claire Bugan. For early intervention, our facilitators will be Debbie and Scott. Diversity will be John Serrano, and I believe he is out today. That should be okay. And then there will be another facilitator to help out with John's group. We have Stacy Katz Shapiro with diversity, as well as Chris Kurtz. For least restrictive environment, it will be Shauna Bilyeu, Nancy Leibach Amon, and Greg Mendenhall. Now, each of these breakout rooms will have an interpreter or two placed in each. So if you think, how am I going to do this breakout group without an interpreter? We have multiple interpreters. We thank them all for their service today in supporting CEASD. And we have a group of champion interpreters. We are all in very good hands today. All right, any other questions before I send you out into your breakout groups? I will be jumping back and forth between the breakout groups. So once you join, pick a topic, each room. If you click on the link for breakout, you will see the 5 different groups and you can join either one of them. So at this time, we're at 1:45 Eastern time. And I say we'll go till about 2:30. If you need a little bit more discussion on a hot topic that's being presented, we may go to 2:40. We'll come back at the end of it so that each facilitator can give a high-level briefing on what was discussed in each of those groups so that we can hear what those topics of conversation were. And then we will wrap up before we adjourn at 3 o'clock. Now, we do have a hard line stop at 3 o'clock Eastern time. Everyone good? Okay, so again, we're focusing on the 5 topics I mentioned today. If you have another topic you want to be brought up for consideration, please tell it to your facilitator and we will consider it for next month's discussion. It could be that one topic is very similar to another. They may be combined. They may be taken into consideration for which priorities we want. Okay, allow me to stop talking so that you can each decide a breakout group. Join any of those 5 rooms. And the rooms are open, ladies and gentlemen.
I'm traveling right now, and so I have a very poor connection. But yeah, I'm Steve Gettle. I'm the superintendent of the Iowa School for the Deaf.
Okay,
Thank you.
great. Thank you so much, Steve. All right, I believe we've introduced everyone. It's great to see you all here. Now, obviously, our topic of discussion is going to be focused on outreach. Some schools have diverse approaches. They have different ways of doing their outreach programs. Some have had outreach established for several years at their schools. Some are separate entities from the
very confused about the process that they're undertaking and under early intervention services, and when we come in to start working with them. But we provide also those birth to 3 early intervention services. And so often when I go in for home visits, with COVID, there were a lot of challenges because we weren't able to meet in person. And so we switched to a virtual setup.
We used to have children at 5 come into school, and we missed those gaps. Nowadays, we've recognized the gaps, and that exposure has increased, but we really have to hone in from 0 to 5. And this is information we've known. With language deprivation, a lot of people fight back on that, but the problem is professionals out there not understanding the significance of American Sign Language and the fixation on English and reading and how deaf children have a struggle with reading. It's always concerned with the literacy, but research everywhere as it pertains to learning literacy is established on phonetic structures, and that comes back down to the reading. So if the children aren't reading, then that means
time. All that requires time. So the Child First Act is there. You know, again, that's exactly how we're supposed to do it. You have to meet the mandates and everything that is required. So where are you looking at?
Goals set up for accreditation. One's data, equity, diversity and inclusion, DEI, principal leadership. And the fourth one, I'm trying to remember, hold off on that. But really, I want to expand on the DEI, has different subgroups focused on curriculum, invisible interactions that you have to see through the student's eyes. And the point is that there are set goals, which means that we have to be putting these into action and following them. I have sent 5 people to take a class about the foundations. And then there's going to be a second 2-day training, and it's going to be focused on curriculum materials, anything that can be adopted, and a cultural response. And we do have a let's see, it can be SEL, emotional curriculum, it can be library materials, or it could be a curriculum that we use in the classroom that maybe has DEI topics in it. And those 5 people that went and learned those lessons are going to teach the rest of the teachers. So we've started that process to try to spread.
There seems to be more participants. And that, for me, has felt like a great success over the last 2 years. So I really have to commend CEASD for their work and progress in this. And I would say, yes, I am going to let Dave kind of explain about our outreach here, because at CEASD Fremont, we've been here about 50 years. We've been established, but keep in mind that we did start to merge with the curriculum department at Fremont. And so how we work with the school districts, working with the teachers of the deaf, providing consultation services, connecting them to our specialist, our curriculum specialist. It's always been kind of a separate entity in the schools. They've been very siloed. Curriculum focusing on schools and supporting the teachers at the school, while we were trying to work with the families out in the state and in our area about reading, and how teachers of the deaf out in the state wanted more training.
Working with each other. My job, I would say, with families, let's say there's one who's hearing, one who's deaf, at 6 months old, then I can help connect them with another family I know. So that is part of what we're doing, is that working together to try and make sure that we're supporting the whole child, the holistic approach. Debbie's saying, thank you so much. That's really good to know about your program. It's clearly doing a lot of work, so I appreciate you sharing that. Laura's saying, yes, it's important work.
And this is Janice. I'd like to add that we're also doing, in addition to the visits, we also do assessments. The DRDP is something that an assessment we can do every 6 months or yearly. Oh, I'm sorry. The light is on a on a sensor. But I don't know, does anyone have any other questions for me?
This is Debbie. Thank you so much. What a great start to the conversation. Okay, so let me just see if there are other people that would like to take a turn. Any comments, anything in the chat, other things you'd like to share for this, talking about the advantages of early intervention. There's a question from Ryan Johnson. Oh, the name of the assessment. You're asking about the name of the assessment. Janice, can you clarify the name of the assessment?
Yes, it's the DRDP, which stands for development. No, let's see. No, I'm not right. Sorry. Designed result development profile, which is something that we're required to do, I believe, twice a year. And it's online. You can download it, and there are 5 domains of communication, motor, adaptive, I believe, social, that it evaluates. And it's a 10-point scale of language and communication, or And this assessment can be done every 6 months, usually in the fall and the spring.
It is required by law, actually. We have the new law, SB 210, and that has required that we do this assessment. So it is required every 6 months. That timeline's incorporated into the law. Debbie saying, so there will be more of a presentation about that, is my understanding. So I'm going to add that. There's information on the website if you'd like to get more information about that. Okay, thank you so much for sharing that. Great question. Okay. Debbie is saying, hi, next we have Jenny.
Hi, yes, and I work at the California School for the Deaf in Riverside, and I have we have a very similar program to that in Fremont, and we really emphasize the home-based care, school-based and in-person work, as well as Zoom. It's been a very similarly frustrating school cycle, working with kids at a young age. It's been absolutely a difficult challenge to contend with the home visits and whatnot. But we haven't had any ability to go into homes. And so we've had to be creative, certainly, and think outside the box. We're continuing with classroom instruction 3 times a week for the parent programs. On Fridays, we're having workshops and webinars, as well as ASL classes.
So you were saying Fridays is a workshop, webinars, and there was another thing, ASL stories, right? All 3 of those.
Stories. As well as play dates that are open to the public. I'm sorry, the interpreter's clarifying. They were open to the public previously, but we have not had play dates with outside families again yet. But I'm hoping that will happen again. Same as Janice mentioned, assessments and one-on-one assessments as people need. Those are also things that we're offering on our campus: physical therapy, speech.
Lead K is very good at establishing data for early intervention, but it doesn't always lead to a diagnosis. When we have a diagnosis, then the next strategy should be to push and how we do that. And I don't see an approach to standard curriculum and things like that when it comes to materials. If we're identifying gaps, we need to maximize and fill those gaps. A lot of teachers have to reinvent the wheel every single year. That's a lot of work. So I feel like that really should be our focus, twofold: identifying the issues and then resolving them as well. And I know a lot of people say early intervention, which I'm aware of, but the reality is we get them late. We just do. So what do we do at that point? Thank you, Rory. Jeff, did you want to say something? Oh, okay, we'll just go ahead with Julie. With Lead K, it did pass in some states. In some states, it did not pass, where the bill did not pass. What we have currently shows some good data in California, Kansas, in addition to Georgia. Georgia just released their 2021 data, and 15% of deaf children are on grade level. That's 15% in the entire state of Georgia. Here in California, it is 18% of deaf children on grade level. And this shows that there needs to be a language foundation when they arrive in kindergarten. They have to have a language to learn how to read by the time they're 8. And then when they're 8, they read to learn moving forward. And if you're missing that portion from 0 to 5, it's because the kids are not reading. And that's where we really need to hone in, is show hard data for language deprivation. Oh yeah, can you tell me the 3 states? California, Kansas, and Georgia. Georgia State. Okay, thank you. Jeff. Okay, Marlon? Yes. With Trisha's comments, it is the reality we're in. With language deprivation, it's an inflammatory term, which means, once you say language deprivation, there's blame placed. Is it your fault, my fault, their fault? Secondly, the significance of American Sign Language. Obviously, it becomes biased, and then people claim it as biased and then shut down. And that's the reason why a lot of states have really pushed back on this. And so maybe taking a step back and thinking about, what has science shown about language acquisition? What does research state?
I live in a majoritively white area. We're trying to recruit people of color to come from different areas, but they don't want to move here because maybe it doesn't fit their lifestyle. And another challenge is that there are many staff who are white who are on committees, and we're trying to get people of color to be put into groups like DEI, but they feel like, oh, I'm the token Black person now, and we don't want them to feel that way, like they're put on the spot. And so we feel like we don't know who to always put in these positions. So we maybe need somebody from outside of our organization to come and have presentations and speakers from different areas. So that is a challenge as well. And this is Jeff Robin here. Are we doing all right here? We only have one facilitator. We're good. Okay, thank you. I appreciate it. Go ahead, Teresa. Yes, the state of California has passed different laws, for example, HSS, that requires that certain things be approached, like, let's see, BIPOC groups or different groups. Let's see, that there was a framework created, and then 3 years later, the law changed. So we have to change the curriculum to confront race. And the mission that was set up for the state of California said that they have to also include Native American history in there too. So the curriculum is constantly changing. And we don't always have staff that understands all of those topics. It helps that the law has been passed that forces people to look at these issues, but at the same time, there hasn't yet been enough training established. And ethnic studies is now a requirement for graduating high school. And a lot of people say, oh, I'm not qualified to teach ethnic studies. So now it's a ring around of who's going to do that. And it does go back to recruitment, because again, it can go back to that invisible interaction and knowing what it's like from the student's perspective. Like, for example, if there's an interview and you have people of color there, but their perspectives are different and things can become argumentative. Like, is there a bias there? Is there an unconscious bias? Do I want to offer it to that person because of the color of their skin or not. Like maybe there's different qualifications. A person of color is qualified, but wasn't chosen. So we have to look at that. Why are these invisible biases affecting our decisions? And I have to self-analyze my own decisions all the time. And that interview process is really important in picking the right person that's qualified and meets the criteria. And how the community looks at it might be a challenge. Thank you for sharing, Teresa. Okay, we had 2 and now we have none. Sarah, if you wanted to go ahead. Okay, hi. I had 2 comments here. The first one, I think in the past 2 years, especially in 2020, we've been thinking about race and diversity. We've all been confronted with that and how it's impacted our students, our school, our personal lives even. But other areas of diversity are important too, like LGBTQ plus community, people with disabilities, that community, the list goes on and on. We want to make sure that we keep them in the forefront too. It's not only racial diversity, but other forms of diversity. Another comment is that Jeff had mentioned before that while there are a lot of schools struggling with getting enough staff, we've been struggling a lot right now. And I think that it's impacted everything. People are overwhelmed. People aren't having the enough resources to really be open to discussing DEI or any other topics. So it's hard to dive into this kind of work since we're limited by having enough staff. And I do think it's important for CEASD to be thinking about in their strategic planning.
Part. So there's the campus-based program, 150 students, and then we have the outreach, but then we have some in-betweens who are on campus and outreach. A lot of that is the parent-infant program and a few other things, but we had some 16 people, but about maybe 3-4 years ago, we only had 6. But that has really grown, and we're working with the LEAP program, the LEAD K program. And so we have a lot of focus where that has just grown and has expanded, and it's been wonderful, providing rich resources for parents, language, assisted listening, FM systems, all kinds of things, ages 3 on. And we are serving about 650 students in the state. And so we've got about 800 that we look at in the state. So about 150 on campus. And so this other outside has just grown. And so again, like you all, we don't have enough skilled staff. And so it's become a challenge. It is a challenge that we're trying to do all of this ourselves, but we are focusing now here with the CEASD, trying to get all of this together so we can partnership. We can use the strengths of different individuals in varying organizations. And so we can see what the states have developed individually, bring it together. Every staff would then have a wealth of knowledge, of information that could be shared and used. Maybe it's something, that we are risking, but we take it on. And, with 16 people working with 900 students, it can be quite cumbersome. And so that's what we're doing here in the state of Kansas. Who's next? Oh, David. David, did you have your hand up? Okay, sorry, I saw your hand real quickly. Yes, I had my hand up there. Okay, yeah. Hi, everybody. Okay, I am excited. I mean, we are living in a different time, post-COVID or pre-COVID, and now we hear we had 17,000 school-age children, up to the age of 22. And, it's like from the time of birth, we want to know where they are. And we find out, just last year alone, we had 1,577 deaf babies born and identified. And so again, we had to look across the campus, the schools for the deafs, or the different programs that are provided. And so we have worked 5%. 5% we're looking at, but we are in the same boat as other people, with the staffing. It's always, you talk about 400 or 500 students, and we are large. We are so large. And, we're talking about 55% of the population. And it's like, oh my goodness, usually it's the other way. But anyways, let me not go on and on. Let me get to the point. So simply, I think here, working with the curriculum and trying to get everything here, we are trying to identify in Fremont, the teachers, their time, it's just amazing. The work that they're willing to put in and the parts that they do. And honestly, the faculty and the staff and the training, before it was like, oh, come on, we need to do this. We need to get the training done. But now it's everybody's on board. And so then we have other faculty and staff positions that are on campus, and we try to move them around and use them full service, full time in school to keep the program strong. And so that's here in Fremont. But then, of course, there is the percentage that is outside of the campus, and I don't know. Okay, so yes, there's a lot of
data. So we need to work on the state level to address that and maybe create change on a federal level. I'm not sure. That's something I need to delve into to look at accessibility across the board and to share that information. How are children doing in different placements, and breaking down that data to help us see the full picture. And then that pushes for change in policy. And so just one of my thoughts, how do we do that? That's a big challenge I see. That's a good point. And you said exactly what I wanted to say, Marlon. Before LEAD K data came out, I typically explained my concerns of what I would see as a professional, the things that I would see. Oftentimes the response I would get is, oh, thank you for your perspective. Who's next? They label it as a perspective, but now we have numbers to show that. And then that forces their hand to have the discussion and find a solution because of that data that we're getting from the grant, which is essentially our own EDI system, which is the LEAD K Family Services. So both the EDI coordinator for the state of California is deaf. Myself and the other are the state coordinators for EDI. We're both deaf. That data helps you justify why services are needed. That is the power you have when you have the data. Even though, as we already know these things, the system likes to see the numbers. They want to see the data. Once they see the numbers, they freak out. They're shocked. And the numbers show that only 5% of deaf children in California grow up with American Sign Language. 95% of them do not have access or full access to American Sign Language. And then we can talk about this issue at hand. Marlon and I are now doing a data assessment for all children. I'm focused on 0 to 5 for Northern California. He's focused on first grade forward, 1st to 12th. And a lot of families have reached out because families are able to bypass the system and reach out to us directly, where we can give them exposure to CEASD and all the opportunities there. Once you have the data in place, you can establish even more services. Yeah, I wonder, you had mentioned only 18% of deaf children in the state of California are on grade level, 5% who have full access to ASL growing up. Is there some sort of correlation to look at if one number goes up, does it affect the other? We don't have specific data in that direction. We have general numbers, but we have yet to break that down and look at the specifics. Marlon and I are working on some new data that's targeted with the Department of Education here in California. Hopefully we get that done before the end of this year, calendar year. If we have that knocked out, then we should have some more detailed data, such as demographics, because we know over 70% of our families are Latinx, over 70%. So that's important information to have to develop accessible information in Spanish for families. That type of information is crucial, and we get that through data. That's good information. Thank you, Julie. Any other thoughts? Yes, Chris. I have a follow-up question in regards to Julie, if you don't mind. A large percent of deaf from Spanish-speaking families, data is being documented where they're not looking at the deafness, but they're looking at general data as far as bilingualism in the state of California. This includes the Spanish language. And so how are they documenting that data? And what does it look like? If that is being documented and used to show the significance of bilingualism, can we parallel that with the deaf population with English and ASL? And what data is being collected to show that? So for example, Marland had talked about the language we use, the terms. We tend to use sign language, not spoken words, but it's the same. There's a lot of different concepts that translate the same way. So how do we track that? How do we show and justify that the number of vocabulary in English is increasing? Is it 10,000, 20,000, 30,000 words? And that means that they have language access and that they're able to express their language. In American Sign Language, how do we show that same value to support language acquisition in general? And so when it comes to the Spanish-speaking population, the data is there as far as what language they have, and then the gaps that exist in ASL and English. I don't know if that data exists. Do you know? Julie, do you want to pop up and respond? So the data, when it comes to Latinx families, is really separate from the Lead K data. So it's part of the Lead K data, but really we did it on our own. It took us a year to identify this data, and this is the only statistic we got, 70%, right? We don't have more specifics beyond that. We've only scratched the surface, just barely scratched the surface, right? So it's hard for me to respond to that fully, Chris. It is an important question, and we really need to delve into it deeper moving forward. Yes, we have much work to do, Chris. Yes, much work to do. And in addition to that, everything I'm sharing is based on my experiences here in California. The more I look into this, and as in becoming an EDI co-coordinator, the more influence I have, the more backlash I'm receiving from audiologists, those who are oral specialists. They do push back quite hard. They push back by refusing to work with us. So I think it's important for us to have discussions about how
having a student representative group. Great idea. And that's out of the box thinking right there. That's what we really need. We'd love to see more of that, something that isn't typical. And to talk to the young people, yeah, that makes sense. Do we have any other ideas? Teresa here again. I want to piggyback off of Leanne's comment. That made me think about what happened in the state organizations like CEASD or Oklahoma, or different states often have a youth training, like for them to become a lobbyist or an advocate, or they've got different kind of youth leadership programs. And I'm realizing that maybe I've been out of the loop. I'm not quite sure what's happening in all the states, but Leanne made me realize that, hey, what happened to that? I don't know if they're still doing that kind of youth leadership organization. And Jennifer here, I can answer that. There are different state organizations and such, but regards to a chapter within a school, within a program, that typically will give, that's more about training them how to become future leaders, advocates. CEASD did an annual advocate day in February for a day or two, and we would see about how laws are passed. And then in the DEI area, there's not one, but that is something that we can look into adding, is having a DEI strand and having our youth be involved either through JRD or maybe something separate with CEASD. But that's a great idea. And that can lead to, now that we're recognizing that we want to work with the youth, we can make an action plan about what to do next. Any other ideas? Okay, hi, Katie. Yeah, this is the last one. I was wondering if there's a survey for staff at the K through 12 program that could ask about interest. I know that there was a survey that found that there was a high percentage of people who were interested in promotion opportunities, but never had an opportunity to discuss that with a supervisor or anything. So that's interesting. I'm thinking, are we missing something? Are we not taking full advantage of those people who might be interested and then move away? But on the staff level, I want to see how we can capture their information, their data, see if they're interested in promoting or not, especially employees who are BIPOC, because we're concerned that we're focusing only on the students, but really we also want to hear from the staff we already have too. That would be a great way to quickly have future leaders. And I understand that you're suggesting that we consider sending out a survey to ask if people are interested in being promoted.
I'm like,
All right, we got some people coming back in. We'll give them a few more seconds. All right, Kat, are you interpreting? Yes, Kat can interpret. All right, welcome back, everybody. So I joined each group for a little bit. It looked like there were some lively discussions going on, some great ideas. Unfortunately, I wasn't able to watch the full discussions of any of the groups, but I'd love to see the brainstorming that was occurring. This conversation will be ongoing, most definitely. But why don't we just have a moment for each facilitator to summarize their group discussion for today. If there are any feedback, thoughts that need to be shared with me, I will make note of those so that we can prepare them for next month. Of course, every facilitator had notes from their discussion. We will collect those and review them and how to frame it for our next month's meeting. If there are other topics that need to be added, we will see during the review. So why don't we start with the outreach group? So Claire, Luann, let me spotlight you guys. And Claire saying, I'm probably going to use the interpreter. So, okay. All right.
So Katie, can you hear me? Or
Hi.
whoever?
Yes.
Okay. So our outreach group, we had about 12 people. We had about 12 different models for outreach. So lesson learned, no school is the same. We know that, but I think we have proof of it now. We had everything from a school that did outreach through contracts with the LEA for a specific service, to schools that offered a broad variety of services, and everything in between. So I think as we work on this, we'll learn more about what each other are doing. I would say some common challenges that we learned about are everybody struggles with staffing for outreach and staffing for our on-campus programs. So that is something we'll want to probably dive a little more deeply in. We have some programs with 15 outreach staff and some programs that don't get 1 penny for outreach. And so they have to just try to do outreach more through public relations, providing information. So we have a tremendous variety there. Another commonality was we need CEASD to help educate the governance structures in our states, be they Department of Ed's, Department of Health, on the role of Schools for the Deaf as the experts in deaf education and the ability to provide outreach. Everybody's frustrated with the lack of cultural competence by special educators and departments of education. So those are a few of the things. We really didn't get to talk about some of the things we're doing well right now, but we will get back to that. That's it. Great group.
Yeah. All right. First group. That's great. Luann.
Yeah, I just also wanted to add that most of the focus was on the CEASD for birth to 3.
That's right.
Birth to 3.
Good point.
Also in terms of creating a pipeline, having that early detection, here's a deaf child, making that initial contact with the School for the Deaf and having them be the point of contact, especially for the 2- and 3-year-old age.
Maybe even having a procedure for how that works. Yeah.
Yeah. Great. Okay. Why don't we go to early intervention and let's let's see here. Debbie, where are you? Where are you at? Okay, and Amanda, if you just want to voice, since I'm spotlighted, if you'll voice for the facilitators, fine.
Yep.
Perfect. All right, go for it. Early intervention group, how'd you do?
Great. This is Debbie. We did a great job. Our conversation was really interesting. So I'll just try to summarize it, and Scott, jump in here, add whatever I'm missing. So to recap, one of the things that came up was that it is not really nationwide, and things are varying a lot state by state. So some states have nothing until 5 years old. They're not doing any birth to 5 programming services for early intervention. Just 5 and up means that there's a lot of gaps happening in that early window. So there are some states that do have a system. It's just not consistent. There's also inconsistency in the referrals itself. Sometimes the referral is not including all the information that it could or should. So that is one of the things that was talked about. We also, in looking at CEASD and what we want from the organization, we want to make sure that there's promotion of more standards, nationwide standards for referrals, for getting services and providing services across the country, as opposed to the discrepancies we see now state by state. For sharing resources, also using CEASD as a place for sharing resources. Scott?
Yeah, I think there's been a really big discussion about just the many challenges across the states and what they're faced with. Just like Debbie said, those challenges are there, but at the same time, we do recognize that just what Claire Bugan and Luann were talking about, that whole process with the birth to 3, that screening process, I noticed that it was really the same discussion as what we had in the early intervention work group. So I think we're overlapping each other in that arena, but I think schools themselves need to be involved. Just like Debbie said, the Schools for the Deaf need to be involved in that early intervention process. An infant is born and identified as deaf through the screening. So how can the Schools for the Deaf then support that family and that infant? I think there was just a lot of information that we need to really catch up on with early intervention. And I think it's a big goal to work with. Do you agree?
I do, Scott.
All right, great. Thanks so much for that feedback. Good job facilitating.
Yeah, and thank you to our group members and to the interpreters.
Sure. All right, next, let's go to diversity. We have Jennifer.
Mm-hmm.
All right, go for it, Jennifer.
Thank you so much. Good afternoon. So, of course, everyone thinks theirs is the best, but I really had the best team. 8 to 10 people talking about things. There were people on various demographics, the West, the Northeast. We covered a lot of geography. Some work directly with students, some are in indirect service. So we had a lot of perspectives at the table in our group. To summarize our conversation, some of the great things we're already seeing is that we're talking about it. It's in front of us. We're unpacking the things that we're carrying around. We are considering curriculum. We're reconsidering things that need to change. So increasing trainings, things like that. So to see the work happening finally is great. Of course, we talked about challenges too. Many people are still learning. Also, we have a different lens. Everyone's coming from a different perspective. There are many of us who in schools have very limited numbers of BIPOC staff. So if there's not many people of color, thinking about limitations, structural challenges if positions are vacated, thinking about promotions, how people are moving within the organization, what we're doing while we're waiting for some of those changes, and wanting people of color to not feel tokenized. How are we genuinely making sure that they feel that they're given opportunities to grow? Another part of our conversation was about the shortage and how severe it is. The teacher shortage, and yes, that has a direct impact on the time we can give to diversity and inclusion work. We also talked a little bit about DEIs, is it DEID? Should that position, that kind of work be standardized? What is it based on? So that was an interesting conversation. And self-assessment, that it has to start with me. I have to identify my unconscious biases, and that is not something that everyone has a skill at yet. It's something we're working on. There's progress that needs to be done. So there was a lot of challenges and talked about in terms of that. Next, in terms of what CEASD can do, there are a lot of great ideas offered. We did talk about CEASD and the Leadership Academy specifically, looking at those who are already involved, maybe administrators, current administrators, or those who are in upper levels of management and leadership, thinking about aspiring leaders as well, those who want to be in positions of leadership, who are working towards that, that it shouldn't be nominations based on the superintendent. It should be self-nominated, that people can speak up about their interests to grow in that way. And that one of the challenges that comes up is financial. People may have the motivation, they're driven to do the work, but where are the barriers and where can we offer support? Another important thing that we talked about that I wanted to share is, in this conversation, are we talking with the youth, with our students? Where do we start with the young people? We're not just thinking about our current leaders, but our children, they're the future leaders. So are we creating a safe space for them to be back in school? Yes, safety is important in terms of the environment the last couple of years, but are we talking with them too about what's going on? I think that was a great point that was mentioned. So I just wanted to highlight that.
Great, thank you. Those are great points. We look forward to more that you will bring us. Next, let's go into language deprivation. Okay, where are you, Amy? I need to find you, Amy. Okay, I found Amy.
Hello.
Okay.
Am I good?
Okay, there we go. I can't find anyone else. All right.
I thought I had another person joining me. What? They left me alone. Okay, well, my group did have a conversation until the very last moment when the breakout groups ended. So we could have gone for another 45 minutes. A lot of information was shared. It was a great discussion. One of the biggest things that we kept coming back to is data, language deprivation, and how much of that information is based on data, that we need to have that data-driven conversation. That's what helps us move and make changes. So the data often is a barrier because we're looking at information from the federal data. The federal information doesn't have complete details. So if there's a way that CEASD could impact that, make a difference in terms of the data collection, the systems that are being used at the federal level. Also, we have been doing a good job of doing presentations and publications, but I think that is still an issue that we're still seeing. Great, my co-partner's back. So thinking about if we are focusing on diagnostics, are we looking at just the diagnosis? What about the assessment? What are the details that go into the rest of the assessment, not just the diagnosis? Often there's a lot of other indicators or things that need to be addressed. What are we looking for in terms of that? And lead K. So we talked about lead K and LRE. There was a lot of things in our group that we saw overlapping with the other working groups. So our conversation was not isolated to our topic. There's a lot of overlap here. Anything you wanted to add, Stacey?
Yeah, I think we talked about funding and just getting ourselves a place at the table for those grants so that we can provide grant training workshops for people to get involved in for HRSA, trying to get those HRSA grants. We also talked about just workshops specifically related to autism and how it is just in the world that hearing are teaching, and then we have our deaf leaders go and we knock our heads against a wall because the hearing, it's very hearing based, very autist based. And so with the resources that we have, we're good in our silo, but once we branch out and we need to teach them that we are here as experts, that's where that frustration comes. And so if CEASD could offer workshops related to that. Also, I believe Cruz mentioned, what was it? West Hall, was that his name?
Yes.
Oh, Wyatt Hall.
Wyatt Hall.
Yes. Doing an official DSM diagnosis for language deprivation. And that's really helpful because that really can provide that pinpointed specific disability that oftentimes kicks off the process that is needed.
Yeah, and in addition to that, that CEASD, one of the other things that we could do as an organization is having talking points, developing standardized talking points that leaders can use when they're sharing information. So I thought that was a worthwhile idea.
Oh, and you know what, Amy? Another thing that was mentioned that I don't want to forget is those kids that are outside of the early intervention age. So they passed that age bracket of 5 years old, but now they're arriving to a school for the deaf or a deaf program so much later in life with language deprivation. What do we now do? Should we have some sort of standardized intervention or strategies for students that come into the deaf programs like that?
Yeah, our slides are full of notes, so I'm not sure if that's something
They
we can
are.
share. Yeah.
Yes.
Share that. Okay.
Yeah, we will share all those notes. So I'm going to let the next person talk, and then we will talk about next steps. So let's go to our fifth group, the least restrictive environment. That's going to be Nancy and her facilitator, Shauna.
We also have Greg.
Okay, Greg. Oh, where's
Yeah,
Greg?
Greg is the one who is actually going to share.
Oh, okay. Let me find him. Hold on. I missed one. All right. There we go.
Hi, everyone. So we did have a good discussion. A lot of the topics that we've talked about, other groups shared about as well. So it seems it came up in several sessions. Our focus was LRE and how that is documented in the law, the intent of the law versus the interpretation of it. So we're looking at schools and how at the state level, how things are interpreted in the actual application of the law and how that doesn't look the same all over the country. So that is different for deaf and hard of hearing students. And that was part of what we talked about. If we want to change that we actually need to partner with various stakeholders related to the LRE. That could include hospitals, talking with medical professionals about what the least restrictive environment means, what LRE means in application to deaf children, children at a young age related to language. Also thinking about other leaders for the Department of Education and what their, as a partner with CEASD, what they can do. Also connecting with, of course, there's the ADA. So any changes have to go through the legislative process, but making sure that at least that is a start to the conversation, that we're opening that conversation up.
As well as IDEA.
In addition to that, I'm just looking at my notes here. We did have a conversation about issues. I think we've already shared on some of that. The other part of the conversation we had was actually,
I think it was Paul Carlson joined.
So recruitment and retention. When he was in the conversation, we were talking about the challenges there, the struggles for recruiting qualified candidates for teaching positions and teachers who are qualified and certified, and for other positions among the staff as well. We know that over the last couple of years, COVID has not helped. People have left due to burnout and other things. So that is something that we've really had to look at. And how do we get people to apply for these positions? Our programs have had to adjust or shrink, and had a conversation about one of the biggest challenges. We had a conversation with the university, but passing the praxis exam, just the teaching exam itself, the assessment. So that has an impact on deaf people who are aspiring to be credentialed teachers, and thinking about how we can look at that and figure out ways to improve that process to recruit more qualified staff. Anything that Shauna or Nancy would like to add on to that?
I think just kind of related to that is the teaching prep programs. Just seeing if there's another strand or specialized field that can really strengthen all of us, where all of the groups can really, they're already integrated, but all of the repetition within that specialized field, I think that's where we are going to need to keep schools alive. And I think that's the point that Mark was making earlier.
This is Shauna. I also want to say that there are so many layers in these conversations. The challenge of how to address them and how to get the message across to people that the LRE is important, but how are we actually addressing that? How the shortage of teachers has a direct impact. So if we're talking about the power of deaf schools, and we're having our own structural breakdowns because we can't sustain the staffing that we need, then recognizing these changes are not going to happen overnight. It is going to be ongoing conversations with people about the LRE. So that's one of the things to be aware of.
All right. Yep. Great. Okay, thank you all for each of the groups. So here's what I am going to do. Give me 1 second. Let's see here. Okay, there we go. Now everyone can see me. Thank you all for the groups, for the facilitators, for the interpreters. Everyone was superb today. So now let's talk about this first next step. We appreciate you inputting all of your thoughts, opinions, comments in the chat, in the groups. There were several comments that were sent to me saying that they didn't get a survey, they didn't see the survey. And so what I think I'm going to do now is we have notes from the 5 work groups. Once we get that together, review that in one of our board meetings upcoming, we will send out another survey to everyone again, all administrators. That survey may go to the superintendents of your respective schools first. They will then send it out to all of their administrators so that we can really gather as much data and information and frame this as best we can. We'll have our next meeting in the first Thursday of December. It seems like the California people got the wrong calendar. So I think some of the time zones are throwing us off. That's why some people were late today. So we will fix that for the December meeting. So that is how we will deal with everything upcoming. We'll get the feedback from you today. We'll review it. We'll tweak anything that needs to be tweaked. And then we will frame it for the December meeting. It seems like for most of the strands, just the overall pipeline of information and the processes seem to be the challenge. So let's see what we can't do about that. Thank you very much for your participation today in the discussion. It seemed like the discussion is really all about our deaf children because that's what we are here for. They are the wave of the future. So I want to thank you all for your investment in them and your participation today. We will see you at the next meeting, the first Thursday in December, first Thursdays of every month. Keep that in mind. Now in 2 weeks, we will be sending out this topic soon. Barbara Raimondo will send out this topic. Next week, Thursday, is diversity, I believe, which is more of school diversity within leadership. So we will talk about that topic next week, Thursday. Anyone else, please feel free to come and partake in seeing that conversation happen. But we do have a lot of exciting topics to discuss, a lot to address. Hopefully, moving forward, we will continue to solve the issues that we face and help deaf education for life. All right, thank you very much. Have a great day. Bye, everybody.